The Eastern Cape provincial government says people will have to wait a few more months before receiving their COVID-19 vaccines. Health MEC Sindiswa Gomba says training workers is taking longer than expected. The province has also yet to finalize sites where the vaccine will be distributed and administered. Joining us is Dr Sibongile Zungu, acting head of the Provincial Health Department. Doctor, thank you so much for joining us this morning. We'll read very briefly an excerpt from the briefing by the MEC, which says, at the moment, we are at the stage where we're evaluating the sites that are going to do the job, checking whether they have capacity in fridges to keep the specimens. Isn't this a little late to be doing this now?
Good morning, Hugo. At this point, for the first phase of the vaccine, we are ready. It's actually all systems go. The first phase is for the vaccination of the health workers. The MEC, as I speak, is at another side of the hospital. We are at Nelson Mandela Academic Hospital, where we are looking at the readiness there. We will also be checking some of the sites like the Matsiganega Zulu Hospital and others. We are checking the readiness for the rollout for the health workers. For the phase 2, we have started looking at the available facilities in the province for storage. This is now the way we are assessing the situation for all the vaccines. We have been made aware that the vaccine that is available for now for the health workers is the Oxford AstraZeneca vaccine. So we have capacity for the refrigerators and for the transit, the transportation of those vaccines. And we have trained the vaccinators, the nurses and the doctors and other health workers whose scope of practice allows for administration of vaccine. At this point, we have over 2,000 health workers that have been trained. The training is done by the National Department of Health. So for phase 1 of the vaccine, we have all the necessary resources. For phase 2 of the program, we are still preparing because the facilities that we will be using for phase 2 are not your ordinary health facility. We will be going beyond the traditional health facility.
Can you give us timelines and outlines of how this will be phased over the next couple of months? Obviously, you'll appreciate that following that report, there seems to be some despondency around the preparedness.
In terms of our preparedness, we have done, like I'm saying, for the phase 1, and we are looking at doing phase 1 from next week and for the whole of the month of February and the month of March. But the preparations for phase 2 have already started in that we have engaged all government departments in the province. We are engaging the municipalities. When I leave this meeting, I'm going to be presenting at the district jogs of Alfred Nzo and OR Tambo, because we are planning with districts on how to reach communities. We have a vast rural settings in the province, and it is important that we have a better contextual understanding of the setting in the province, understanding of the infrastructure that is available in the rural areas, understanding of the reach that is there in terms of access to those areas, and also ensuring that we minimize the inconvenience to the public to reach sites that will be used for vaccination. We are also working with the private practitioners to ensure that they are registered and accredited for vaccination, to be vaccination sites, as well as the pharmacists and other sites that we have in the province. We also have academic institutions that are in the province. We are working with them also because they have their campus clinics to ensure that we increase the numbers of sites that are already available standing and others that we are going to prepare outside the health facilities.
Dr. Zungu, we know that in December, Eastern Cape was at the epicenter of the second wave. Can you give us an idea of how figures are at the moment?
At this point, it is such a relief for the province that when in the middle of December and end of November, we were running at close to 2,000 cases per day. And at this point, we are running at about 200 on average, 200 cases a day. And that is a relief to the health system, a relief to the health workers that have run with this burden for almost 10 months. And it is also a relief to our resources that are stretched to try and cover and ensure that we provide services to as many people as possible. Whilst we are having this relief as a province, we are also now starting to ramp up our screening activities, because for the second phase, we need to know who has comorbidities and who has to be included in the vaccination program in the phase 2 when we look at people with comorbidities. So this relief has given us a bit of a chance to be able to cover as many people as we can.
Now, Doctor, I'd like to imagine that you would have challenges with staffing, or certainly availability of staffing in the Eastern Cape. But yesterday we carried a report where you're supposed to have terminated, the Eastern Cape is supposed to have terminated the jobs of 625 nurses. We also learned that those 625 nurses have now been reinstated. Can you give us a sense of what's going on around these 625 nurses?
The 625 nurses are part of the nurses that were doing community service in the province. And community service is a policy that was introduced by the National Department of Health, and it is practiced by all provinces from 1997, I think. The policy was introduced for medical officers, and when they complete their internship, they then go for community service. And then other health workers were also introduced into the same policy in a graded fashion. And it is not long that the nurses were also in the same policy dispensation. The community service for the nurses is a one-year contract. And at the end of that contract, then the professionals join the job seeking. They can go to look for jobs at health facilities of their choice. So in this instance, the province was preparing and ensuring that when these professionals need jobs, they can join the service in April. Reason being, at the moment, we have the staff that was employed for COVID-19, whose contracts are ending at the end of March. And then we would have then a contingent of staff that would then be joining the service at some point on the 1st of April. The province is under a very tight fiscal space. The funding that we have is limited, and also the cost of compensation of employees for the Department of Health in the province is very high. So how we employ needs to be covering our areas of need, and how we deploy the resources that we have to cover those areas where we have gaps. So it's not an automatic thing that happens. It has to go with addressing the gaps that we have in the service, and also ensuring that we have a balance in terms of the equitable distribution of the resources of the province.
Doctor, before we let you go, we know that Nahal is planning to be a part of the vaccine rollout program. Are you amenable to working with Nahal in this?
We are pleased to have as many partners as possible. And in the initial phases, we would like to work together with our organized labor to ensure that the coverage of health workers in the first phase is as far as we can possibly go. And we have extended also a word to organized labor for them to look at our list and to see if we have covered the categories as far as we could go, to ensure that everyone in the health workers sector is not left behind. And when we go outside, we would also be working with other groupings at the Office of the Premier, where we have the overall coordination in the province. We have also organized labor represented there, because the vaccination program will also go to different sectors in terms of labor, in private sector, in the province. So even there, when we are at that point, we also need to continue working with organized labor to ensure that the coverage is as far as we can go.
Dr Sibongile Zungu, thank you so much for speaking to us, acting head of the Provincial Health Department of the Eastern Cape.